All right, so now we are ready to explore the second kind of classification system that we can use to group the joints together, and we're going to spend a lot more time on this system. These are the terms that I think are probably more widely used and certainly more important for you to have a good grasp on. And so we'll be talking about joints from the standpoint of their structure now. And there are, so when we think about joints and how they're built, then there are three different main groupings of joints that we can talk about. The first are the fibrous joints, the second, the cartilaginous joints, and the third are the synovial joints. And you've already been introduced to those terms, so we're just going to dive right in then into talking about the fibrous joints. All right, so fibrous joints, these are joints in which the articulating bones are held together by dense fibrous connective tissue. And so that means that there's lots of collagenous fibers that extend from the matrix of one bone and across the joint and then embed in the matrix of the next bone. And so it is the strength of those collagenous fibers primarily that hold the two bones together. These don't have a joint cavity, and there's some variability, I guess, in how much the joint can move depending on the way that the joint is built. And when we further subdivide the fibrous joints, there are three terms that relate to these types. First is a syndesmosis. The second type, the second type is a suture, and the third type is a gomphosis. So here we see the suture lines of the skull. Those are sutures. This is showing an interosseous membrane, which is a syndesmosis type. And then this last one, it's a tooth sitting in its socket, and that is a gomphosis. So gomphosis, sutures, and syndesmosis. Those are the three types. So let's look a little bit more closely at each of these joint types. And we'll start with the syndesmoses. With a syndesmosis, the articulating bones are held together, but they don't touch. So they're held together by either a sheet of dense fibrous connective tissue, and if it's a sheet, then it would be considered an interosseous membrane, or by a bundle of this dense fibrous connective tissue, in which case we would talk about it as an interosseous ligament. And they can allow some slight movement, and for some there can be considerable movement allowed around this. And but the primary role here is to hold those bones in close proximity to each other. The fibers don't stretch easily. Remember, collagenous fibers are not very stretchy, but they are super strong. So where do we see these kinds of syndesmoses? Well, here's some. These are the interosseous ligaments here. So this is from a cadaver where I found the picture from. And this is the talus here, so we're looking at the foot. Here is the femur, the distal end of the femur. And here's the medial malleolus. So here is another one of these ligaments. So here's the lateral ligament that is holding the, it holds the femur to the, here we have the lateral malleolus of the fibula. And so that would be one of those interosseous ligaments. And it's harder to see. I couldn't find any non-gory pictures of an interosseous membrane. So we'll have to just go with a cartoon here showing the interosseous membrane that we find between the radius and the ulna. So this will allow some movement. You know that if you were to hold your elbow steady and then rotate your wrist, you're going to be moving the radius around the ulna when you do that. So the that radial-ulnar syndesmosis, or the interosseous membrane there, that will allow some movement. And the same down here with these very short little ligaments here. They are primarily holding bones together. There's not a lot of movement that they allow. So that would be one that doesn't give very much movement, if any at all. And to roll your foot over, you have to really stretch those fibers. And so, that rolling your foot usually involves some sort of damage especially to those fibers. All right, so those are the syndesmoses. Next up are the sutures. And here we've got a view of the top of the skull. And so you can see there are sutures aplenty. The only place that we find sutures are in the skull, between the bones of the skull. And a suture is formed by a very thin layer of dense fibrous connective tissue that grows between the bones. So while the bones are ossifying, then this thin layer, the sutural ligament, will form, holding the bones together. Notice the extreme undulations in the suture lines. That also helps to hold the bones together, because you've got a lot of surface area for that sutural ligament to hold. And so it's like having puzzle pieces. You know how a puzzle piece will grip to each other. It does kind of the same thing here. They form where more than two bones come together in the skull. That's where we see the fontanelles. And so a fontanelle would have been right here. And if we were to go more to the anterior surface, there's the anterior, that fontanelle that's there at the front of the skull as well. And so the fontanelles can allow pretty significant movement of the skull bones during birth, but eventually, as the fontanelles become ossified, then they are completely replaced with bone and a suture line there as well, after which, once that becomes solid, then there is no more movement allowed of the skull bones. Okay, so I think that's about all I have to say about the sutures. So let's move on then to the cartilaginous joints. And I'm sorry, wait. I've missed one. Let's move on, not to the cartilaginous joints, but to the gomphosis. So here's a gomphosis. The only place that we find gomphoses are at the tooth. So and for me, one of the ways that I help to remember is that the tooth is kind of embedded in the gums. So I don't want you to confuse it and write or name it a gomphosis, but gomphosis helps me to remember gomphosis. And so a gomphosis is a peg and socket kind of joint, and so the tooth is the peg, and the socket in the maxilla, in the mandible or the maxilla, that's the hole that little peg fills in. And a gomphosis is formed by very short bundles of collagenous fibers, referred to as the periodontal ligament. And here, this is a view of a young tooth growing in its socket, and you can see this layer that will eventually become the fully developed gomphosis, or periodontal ligament. So it holds the tooth really firmly in place, but it does allow a little bit of flexing so that you have just a little bit of give in the chewing action. That helps to prevent damage of the tooth too. So what small bit of stretch you can get out of collagenous fiber helps to give a little give to that joint and prevents it from breaking. And again, only found in the oral cavity. That's the only spot where we see gomphoses. All right, so that is the syndesmoses. Now let's move on to the next category, the cartilaginous joints. And cartilaginous joints, first an overview of them. In cartilaginous joints, the articulating surfaces are held together either by hyaline cartilage or by fibrocartilage. We don't see elastic cartilage forming a joint. It would be too stretchy. It wouldn't be of much value if it were elastic cartilage. Again, no joint cavity in a cartilaginous joint, and they are either completely immovable, but most have some slight movement available to them, these cartilaginous joints. Okay, two kinds of cartilaginous joints for us to look at. There is the synchondrosis. A synchondrosis has the bones unite or are held together by a band or a plate of very, very stiff hyaline cartilage. So you have some strength there, but as long as it's hyaline cartilage, it's going to be weaker than the bones themselves. And these synchondroses tend to ossify with age. So over time, the cartilage material is going to become very, going to become bony. So the epiphysis and that epiphyseal plate that is there between the epiphysis and the diaphysis is one example of a synchondrosis. Also, the cartilage that you find between the first set of ribs and the manubrium of the sternum, that one that ossifies with age that we talked about already when we were looking at the structural classification scheme, that is also a synchondrosis. I like this picture. I thought it was a great view of, while it's a preserved bone, it's not fresh tissue. You can tell that because the blood here in the red marrow is not, it's brown rather than being red. But you can really see how we've got this layer here of cartilage material that is growing and developing in between the epiphysis here and its secondary ossification center and the diaphysis with the primary ossification center. Okay, so that's the synchondrosis, and now we'll look at the symphysis, the second kind of cartilaginous joint. In a symphysis, the articulating surfaces are covered first with a thin layer of hyaline cartilage. So we have that thin covering of hard cartilage, but then there, in between the two layers then of the hyaline cartilage, we have a disc or a pad of springy, very tough fibrocartilage. And some examples of these, and they permit a little bit of movement. So the examples of them are the intervertebral discs between the vertebra, that they are situated between the vertebra bodies, the body of the vertebra. And it's because it's so springy and dense, it's very good at absorbing the shock that's involved when we're walking and running and jumping, doing all those kinds of crazy movements. The symphysis pubis, in between the pubic bones, is another example of a symphysis cartilaginous joint. And this is the pad of cartilage there that becomes more stretchy thanks to enzymes that the mother is producing late in pregnancy. And so it becomes stretchy enough that the pubic bones can push apart as the baby's head is passing through the birth canal. Okay, so there we have the cartilaginous joints with their synchondroses and the symphysis. All right, last of all, to the most complex of the joints as we classify them structurally, and those are the synovial joints. Synovial joints allow free movement of the articulating bones. They don't necessarily move in every direction, but depending on how the joint is constructed, they have very free movement. They're not restricted in whatever the plane of movement or planes of movement that they can move in. And here finally we see that the articulating surfaces is enclosed in a very dense, irregular connective tissue capsule that creates this space called the joint cavity. So here is the joint cavity with its layer of dense irregular connective tissue that surrounds it, and lining it is that synovial membrane. That's what this blue stuff here is supposed to be, is the synovial membrane. And the synovial membrane secretes the slippery, lubricating, shock-absorbing synovial fluid that we associate with synovial joints. So the bones are held together by the fibers of the joint capsule, and then the bones are allowed to move past each other, thanks in part to the lubricating effects of the synovial fluid. As well, there's a layer of hyaline cartilage that covers the joint surfaces, the bone surfaces that are found inside the joint. Okay, so let's look now at the structure and anatomy of synovial joints. So in synovial joints, the articulating bones are not allowed to touch each other. That's the goal, at least. When they do start to touch each other, that's when people start experiencing some fairly extreme joint pain. So there's a space always between, in a healthy joint, between the two articulating bone surfaces. And that space is filled with that synovial fluid. So the cartilage layer that's inside that covers the bone, where the bone is inside the joint capsule, is referred to as articular cartilage. And so it's a thin layer of hyaline cartilage that covers the surface of the bone. And if, say, arthritis or some other degenerative disease of the joint occurs, then pain starts to become very, very noticeable when the that articular cartilage disintegrates so much, and the bone then has the ability to grind against the other bone. The joint capsule is built of two layers of connective tissues. Again, the external layer is a tough fibrous capsule, and it's continuous with the periosteum of the bones. So the fibers here are continuous with the periosteum fibers, and they connect with and are continuous with the fibers of that are embedded in the dense compact bone that surrounds the bone. So not only do those fibers embed into the periosteum, but of course the periosteum is embedded into the bone. So that when we do pull, if a muscle is, reaches across here, so if we have a muscle like this, then when it shortens, it doesn't pull the periosteum away from the bone, but instead the bone moves. So the internal layer, right here, it's the dark blue layer of the joint capsule, is referred to as the synovial membrane, and it's composed of areolar tissue. It lines the capsule, and it covers all the surfaces inside the joint capsule that aren't covered by the hyaline cartilage. So there's two surfaces inside of a joint: areolar tissue and hyaline cartilage. And so this areolar tissue can secrete the synovial fluid, and over time it will also resorb the synovial fluid. So it's constantly making and then drawing back in fresh fluid. It can also store adipose tissue as fatty pads, and so in a second we'll see that there are some additional components of the joint, including these fatty pads. All right, so let's keep going, looking at anatomy. Ligaments are also going to be associated with the joint capsule. So these are thickened parts of the external layer of the capsule, and they reach up and connect to the bone. So the ligament reaches out from the bone and becomes part of the that external layer of the joint capsule, and then can even reach out to the other side to hold those bones together. That joint cavity is the space that separates the two bones that are moving against each other, and it's filled with synovial fluid. So here is a cadaver that's been sliced right through the shoulder, coronals, or a frontal section right at the shoulder. You can see the spongy bone of the epiphysis right here. This is where the epiphyseal plate would have been, and here's a little more spongy bone, and then this is the medullary cavity of the diaphysis. So here you can see very clearly where that joint space is, and so the joint cavity is lined again with that areolar tissue and secretes all the synovial fluid. The synovial fluid itself is a slippery, really viscous fluid. It contains proteins that are kind of slippery, so albumin, if you think about egg white, and synovial fluid kind of has the consistency of egg white, but albumin is one of the primary proteins that we find in egg white, and so it has that same slippery feel that egg white does. It also contains a kind of acid called hyaluronic acid. This is not excuse me for that yawn, I apologize. It's the middle of the afternoon and I'm approaching my sleeping zone. It's not that it makes, it's not a particularly strong acid, but hyaluronic acid is part of, it actually is material that's used to hold cells together. So the albumin, the hyaluronic acid, they help to reduce friction there in the articular cartilage surfaces. So where the hyaline cartilage could potentially rub, this slippery fluid helps to really reduce the friction between them and help to reduce any wearing of that cartilage-covered surface. It also supplies the fluid also supplies nutrients to and removes wastes from the cells of the cartilage that are there in the joint capsule. And there's phagocytes there that will help to clean up any of the tissues that, any of the waste materials, bits of tissue that come loose or available in the joint just because of the wear and tear of moving. Okay, now we're looking outside the joint. Again, the tendon is, so if ligaments connect bone to bone, tendons connect muscle to bone. And so tendons can be part of this joint capsule as well. And it just helps to stabilize the joint and do that connecting thing back to the things that are going to move the bones, the muscles. And then not every joint has these structures, but many do. We may find in a joint these fatty pads that the areolar tissue builds. So here's one of the fatty pads. The role of these pads is to kind of fill space so that as the shape of the joint changes, when the joint is being used, so when that, say if I were to flex my elbow, that's going to cause real changes in the shape of the cavity inside my elbow's joint cavity. And so those fatty pads can kind of move from side to side, not that they're picking up and disattaching themselves, but that tissue can be squeezed into other areas. So it just helps to fill space as the joint itself changes shape. And here's another little fatty pad proximal to the that connection, the joint area. Menisci, you may have heard that's plural. A meniscus, that is a crescent-shaped wedge of fibrocartilage. And the reason it's called the meniscus is because, let's see, if you look at it from the top, it's like a circle, and usually the center of it, it's either open or it's just very thin. So it's kind of like a donut, except that now we're going to look at it in cross-section. It comes down to maybe nothing right in the middle. So we're looking at it in cross-section here. This is the outermost region of the meniscus. So that's here where it's thickest, and it tapers to a really thin little layer right in close at the center part of the joint. And so these menisci help to absorb shock. They can stabilize and stabilize the joint and improve the fit of the joint. Again, as the bones, as they rotate against each other, or move against each other, they will be that the meniscus is there and kind of helps to hold everything in place, helps to reduce any risk of dislocation. Okay, almost done. We just have one more thing to look at in the way of some additional structures that may be found in the joint. Bursae, and again that's the plural, here's the singular, a bursa. So a bursa, or bursae if it's plural. These are little flattened fibrous sacs, so they have an outer dense, irregular connective tissue layer, and then an inner layer that is built of synovial membrane. So that should be sounding a lot like a joint capsule to you. So it's like a little joint capsule, but it doesn't have any bones associated with it. So it is just a little pad of cushioning that may be found around the joint. So I'll go back to the previous slide. Here is the prepatellar bursa. So that bursa, again, it's not inside the joint cavity, but it does, it's a little fluid-filled pad that is there to help cushion the anterior surface of the patella. There's another meniscus right down here. I'm sorry, bursa right down here. So these bursae, they're just these little thin sacs that develop in places where ligaments or muscles or tendons are rubbing against the bone, and their role is to reduce friction. They can also become very inflamed, at which point Aunt Edna says, "Oh, my bursae, bursa, that's just, I've got bursitis now," so the pads can become very inflamed. And if you were to go online and look, you would see pictures of people's elbows horribly misshapen because these bursae can get very, very large as they become inflamed. Last of all is a tendon sheath, and so I've got a couple of tendon sheaths to show you. But again, the pictures of dissections either with the patient living, which would be called an operation, or after the patient's dead, when you start dissecting on a cadaver. It's just too grim and grisly looking to put them into the slideshow for you. But you are welcome to go or I encourage you to go and look up tendon sheath or bursae, and you'll definitely come up with some pictures that are a little bloody and kind of gory, but very enlightening. So these tendon sheaths are like a really long bursa that can wrap completely around a tendon. And again, the point of the tendon sheath, just like the point of the other bursae, is that we want to reduce friction as the tendon pulls and moves the joint. So there you have it, the anatomy of the three different classes of functional classes of joints, where we looked at the syndesmosis, where just fibers are holding the bone together, and then an I'm sorry, did I say that right? Let me just check. Yes, the here we are, the fibrous joints. That's where I was going wrong. So we had the fibrous joints, which included the syndesmoses, the sutures, and the kymphosis. The cartilaginous joints, which were the examples, were the synchondrosis and the symphysis. And then finally the synovial joints, where we could look at all of the different parts that may be present in a synovial joint. All right, so the next section will be coming soon.